Dr. Pekosz, I talked to Ofer Levy of the Children's Hospital in Boston about 10 days ago, and he was heated that a vaccine applied to an adult is different than the same vaccine applied to an adolescent, whether they're 17 and particularly on down towards 12 years old. Describe the challenge you have as a pro in a vaccine for someone 32 versus a vaccine for someone 15.
Well, much of the biology of the immune system is incredibly different and very much dependent upon age. Even simple factors such as dosing based on body mass are all factors that have to be empirically determined. And that's why you see these clinical trials now that are focusing on children that are breaking down the age groups into smaller and smaller groups. Remember, adults were basically 17 and above, right? Right now we're going in age increments of about 4 or 5 years or so because of the challenges that are produced by trying to move into those populations with the limited amount of data that we have so far. So very important to get this right, because children represent a population that could really help us move toward a herd immunity sort of endpoint. But the studies that should be coming out next week are going to be very important in terms of understanding the dosing and the side effects in those populations.
And just to sort of tie a bow on this, if we do get those 12 to 16-year-old guidelines next week as expected, how quickly could we see kids start to get vaccinated, and perhaps how much does that accelerate the path to full immunity?
I think you can see vaccinations start almost immediately because the vaccine right now is out there. As we've all sort of been seeing, the vaccine demand is starting to diminish a little bit. And if we look at the initial rollout of the vaccine, my guess is that there'll be a large bolus of individuals who are very willing and want to get the vaccine that will line up very quickly. So I think that the rollout into children initially will be very fast and very high. And then it's really just then going to be a question of sustaining it and getting it to a high percentage, running into similar problems that we see now with the adult population.
Andy, what do you think the biggest issue is underpinning hesitancy at the moment?
I really do think it's getting the information to people in a way that they are comfortable understanding it. From a scientific standpoint, I really am amazed at the wonderful data that's coming out about these vaccines almost on a weekly basis right now. So the data is there. Communicating it effectively to populations is what's really important. And of course, getting at the issue of equity in vaccines, finding the populations that don't have access to it, that haven't heard much about the benefits of the vaccine. Getting to those populations is going to be the really critical thing right now.
Dr. Pekosz, what do you think of New York City's decision to advocate for vaccine tourism, that basically if people come here to visit from other countries, they could get a vaccine and get first in line?
More vaccinations are better, and everybody's trying to be, I think, creative about how to do this. Bringing someone into a country, vaccinating them, remember, your effect of the vaccine then takes several weeks before you can actually, get the benefits of that. So the timing of some of these things is important. And again, we're allowed to do a lot when we're vaccinated, but we have to remember that it takes some time for a vaccine to actually get you your protection. And so that's, I think, the critical thing to remember as we roll out some of these policies that may allow for greater travel or greater access to vaccines for people who are non-residents.